How do you pass these NCLEX exams? Is to know your NCLEX concept. So we're going to review 20 questions that focuses on NCLEX review concepts. And then I add a little bit of pharmacology because that's also, you have to know the tips. They like pharmacology. Most of the system problem, you have to know pharmacology. So stick around and then see what I have for you. First question is a calculation question, is a burn question. I will show you how I do it and make it easy. What is the total body surface area? If they give you this, just relax, sit back, read it carefully, underline keywords, buzzwords. And next is receiving report for a 50-year-old client with hot water burn to what? Anterior and posterior torso. Two things. Anterior left leg, one thing. Posterior left leg, left arm. Then you draw your patient in the box form, okay? And you said to yourself, anterior torso, the whole here, 18. Posterior torso, another 18. You have to know the percentage. Anterior left leg, the whole front portion on the left leg, that's 9. Posterior left arm, the back side is 4.5. Then you had them, 18 plus 18 plus 9 plus 4.5. And this will give you 49.5. You have to be able to break each line down to be able to add it together. Otherwise, you make a mistake and then you get it wrong. So that's the way. You have to know that the front, the whole front, chest and abdomen 18, back 18, 18. The front of the leg is 9, the back is 9, and the front of the arm is 9, and the back is 9. And then you calculate all of them together. If you had the head, the neck, and the perineum, all of them will add up to 180. But you have to know how to calculate them. But just know this addition and subtraction and multiplication of burn injury and be able to deduce which area is involved. Okay, first question is taken care of. Now, the same patient, right? And nurse is receiving a report for a 50-year-old client with hot water burn to what? The same area. And I want to show you detailed calculation. Anterior, posterior torso, anterior leg, and posterior arm. How much fluid rate, I say rate, the nurse will give the first 8 hours. This is a little bit complicated. So first, calculate your total body surface area, which we already calculated. We get what? 49.5, right? You have to use the Packlum formula, okay? P formula, which is the 4 ml, okay, times the total body surface area, okay, times the weight in kilos. I give you the weight in what? Pounds. So 5.4 over 2.2. Because that's the conversion between the kilos and the pound. And therefore, because 1 kilo is 2.2 pounds. Therefore, this is approximately 70 kilos. So we multiply 4 times 49.5. We already calculated it, times 70 kilos. 863. So you can calculate it yourself. 13,860, sorry. This is the volume of fluid the patient will need 24 hours, right? The whole 24 hours. That's how much. But I told you, what you give the first 8 hours, you divide this by 2. So this divided by 2 is what? 6,930. This is how much volume the client will need. 6,930 liters, ml of fluid, right? That's much the client will need. But in 8 hours, we calculating the rate. We have 6,930 over 8 hours. So divided by 8, and we get, so this is ml. We get 866.2 ml over an hour. So every hour, the patient will get this fluid. But that is how you do it. First, calculate the body surface area, which we calculate already. Calculate, convert the pound into kilos, which we did. Then multiply by 4 times the body surface area. You get fluid for 24 hours. It's not the rate. It's just the fluid, 1,360 ml. If you have to give 8 hours, the first 8 hours, you have to divide it in 2. And then that volume you get, you divide it by 8 to get the rate. If they ask you to calculate the rate for the 16 hours later, it's the same thing. 6,930 divided by 16 hours. That's later on. So the fluid rate will change. So that's how you do it. Third question. A nurse is caring for a client with new asthma diagnosis. Okay, this question is critical thinking. I want to know how you can think critically. Which of the following need immediate intervention? Select or apply. You know I like select or apply. Patient keywords, asthma. Okay, I need intervention. I did not give you any information. You have asthma. Which one do you need to intervene? Then you think, asthma patient, what do they need? They need bronchodilator. They need a beta agonist, which is an androgenic, okay? Beta agonist. So it can stimulate your heart rate. It can increase your heart rate, your blood pressure, and everything, right? What does agonists are? Agonists are stress hormones. They can stimulate. No, they are not hormones, but they are stressed. We release them when we need stress. Epinephrine, no epinephrine. And what do they? They are stress released from the adrenal gland. What do you think these do? They increase your glucose. So Albuterol, which is an agonist, will do the same thing, beta agonist, right? It will do the same thing. So what do you think? If you give somebody Albuterol, that's why they tachycardic. That's why they have tremor and everything. And what do? They increase your glucose. Somebody with diabetes, their glucose will be disrupted. So we got to change their medication, titrate their medication. So I need intervention to make sure we know about this patient. Otherwise, they will get into trouble. History of recurring GI bleed on propranolol. What do you think? Propranolol is a beta non-selective blocker. So it's non-selective. If it's non-selective, it's going to block the beta receptors on the bronchus, and therefore we should question it. In my lecture, if you check my videos online, I have BAM. If you have BAM, you save. Bisoprostol, atenolol, and metoprolol. Those one asthma patient can take it. The propranolol, no, asthma cannot take propranolol. So this patient, we have to question. History of allergies, yeah. We can't do anything about it. Most people who have asthma have allergies, so don't worry about it. History of Conn's disease, another critical thinking. This question is the critical thinking question. I intentionally said it this way, thinking like an examiner, right? Conn's disease. What is Conn's disease? Is a tumor that secretes what? Aldosterone, right? And what does the aldosterone do? Increase your sodium and decrease your potassium. Guess what? Asthma patient will be on Albuterol, right? That's the common medication they're on. What is the side effect of Albuterol? It's hypokalemia. We have 2 medications that will, a condition that will cause hypokalemia, and patients taking another medication that are going to cause hypokalemia. I'm worried about it. We're going to have severe hypokalemia. That is a classic question I need you to pay attention. When you see this thing, connect the dots. But good question for you. Questions, comments, you can put it down there. Let me know about it. If you've not subscribed, subscribe to the and check the link below and subscribe and get more content like this so that when I make it, you get it. Who would you want to see? They are all Myasthenia Gravis patients. Keyword, the only thing you care about for this neurological problem is airway. You are being sharp when you do that. So Myasthenia Gravis patient with incontinence, I'm not worried about you. Myasthenia Gravis with weakness at night, that is what I expect. Incontinence, that's what I expect. Myasthenia gravis with ptosis at night, I expect that. When you select this, it tells me you are very sharp because you know that you're taking care of what? A breathing problem, electrolyte, shock, hypothermia, airway, and pain. And airway is number one. And when they have slurred speech, they can talk, their speech is affected, they can swallow. Yes, that's a priority. What do you think? Client with the gout, they all are gout patient, right? What is gout? It's an inflammatory problem due to depositing of uric acid in the joint, especially your great toe, great big toe, the big toe, okay? Always get into trouble. The little fingers, toe are okay. What do you tell the patient? Drink a lot of water so that you don't form those crystals, right? 2 to 3 liters of water is good, right? Client with gout, avoiding organ meat. Yeah, you tell them to avoid organ meat. Organ meat has a lot of what? Purine in it. So the issue, organ means, when they give you a word, I've said before, scientists don't know how to describe things. They use the word organ meat. What in your body is an organ, right? Look at it. Liver is an organ, right? Kidney is an organ. Brain, okay? Your heart is an organ. So when you have a meat that is coming from your liver, yeah, don't eat it. Coming from the kidney, don't eat it. Brain, don't eat it, So you minimize that. You avoid them completely, right? So this patient, we don't need to see them, right? So this one. So they're doing the right thing, so we don't need to see them. These two. Client with gout, avoiding protein diet. That's the problem. You will never avoid protein. The diagnosis say avoid purine, something that is purine in it, right? So why do you want to avoid protein? Our body, okay, need what? Protein. You can't function without protein. So this patient, yeah, I need to see this patient. He's doing something bad. You need some protein to grow. So that's the one I will see. But 1 and 2 is fine. Client with gout on allopurinol and a rash on the torso. Yeah, that is allopurinol is a what? Sulfur drug. When you have sulfur drug with rash on your chest, it's Steven Johnson syndrome. Yeah, we have a problem. It's a B-sharp moment. So I got to see you. Client with acute gout, prescribe allopurinol. If you have acute gout, allopurinol is used for maintenance to prevent recurrence. But if you get a recurrence, you should treat the inflammation. So we don't need allopurinol. We know NSAID, indomethacin. Those are all colchicine. Those are the ones we need for treatment. So this patient, we got to see them. So 3, 4, 5, need to see them. It's a SATA question. When you see a SATA like that, that means there's multiple people that you should worry about. They're doing something wrong. Number 6, which client do you see first? Same thing, asthma. Nowadays, I take one disease and I go down and tell you how they can set a question so that you see somewhere. They don't going to put it together like that, but to show you what is the key thing you should focus about each diagnosis. Asthma, exacerbation, and no wheezing. This is what we call what? You have to be sharp. An asthma patient that is no wheezing, I don't like you. If you're wheezing, I love you. So no wheezing is what we call silent chest. So I'm worried about you. So this patient, he's tired. He can't breathe anymore. He's going to have a respiratory failure right away. Acute asthma exacerbation, prescribe what? Theophylline. The word is acute. In acute asthma exacerbation, you got to open the bronchoconstriction, give them steroid, and give them oxygen. You can't give them something that take a long time to work, something that needs to be followed, something that need maintenance. Theophylline is a maintenance medication, even though it acts as a bronchodilator. It's a trap. It's a maintenance. It does not act fast enough for an acute situation. Patient will be dead. So, right, I need to see this patient, okay? Acute asthma exacerbation with a heart rate, what, 115 post Albuterol. We already said it. Albuterol is an agonist. It's a beta agonist. I give it to you, it will stimulate your heart. It will give you tremor. you sweat, palpitation, unexpected finding. Don't worry about it. Acute asthma exacerbation, giving albuterol before inhaler, steroid. Guess what? I have obstruction, but I need to take care of the inflammation. Bronchospasm, yeah, but I need to take care of the inflammation. If the tube is blocked, no matter what you put the steroid, it's not going to go. So open the tube, okay? Open the tube with the albuterol and then give them the steroid. So we're doing something good, so we don't need to intervene. So this one we don't need. Number 5, acute asthma exacerbation, taking propranolol, drawing med review. We already said it. Propranolol is beta non-selective. It's non-selective beta, and this will block the albuterol effect on the bronchial tree. That will cause more bronchospasm, and we get into trouble. So we got to see these patients. 1, 2, and 5. Test taking skills, strategy on pharmacology, and thinking in doing prioritization. Number 7, this is content to give you some content. Which of the following the nurse should expect or anticipate? Select or apply. What is the problem? A nurse is receiving a report for a client diagnosed with what? Schizophrenia. What do you think? What do you think? Keywords. You got to break it down. How do you break this down? Buzzwords. Schizophrenia, report, and what do I expect and anticipate? Only 3 things. So, schizophrenia and my expected finding. I know this is what? Psychotic problem. How do you diagnose this? You need positive symptoms and at least 1 negative symptoms. What are the positive symptoms is what they use for diagnosis. And everybody who has schizophrenia, form of disorganized thought, hallucination, and delusion. They are negative symptoms. Think about it as depressive symptoms. Don't memorize them because there's a lot. Catatonic, it does not move. Patient stay in one place and does not move. Yeah, that is not one of the positive signs. So it's a negative. So look for those that are not the 3. Disorganized thought, hallucination, and delusion, and the rest has to be what? Negative symptoms. So I see flat affect here, I'm picking it, right? I expect that. And 1 negative symptoms. If it's a psychotic problem, I treat it with what? Antipsychotic, against psychotic. And what do I see? Ziprasidone, which is what? Atypical, right? And fluphenazine, which is typical, 1st generation. You have to know this medication and be familiar with them. How do you remember the 1st generation? You see the Zine, they all have the Zine name on it. The 2nd generation, there's different group, but ziprasidone has its own group with the last name Don. What is your management for this patient? Initially, when they come in, their physical need is your priority. After you establish your physical need, you don't put them in what? Group therapy right away. You start with what? Individual therapy. You, the nurse, are their therapy. So they will be talking to you. They will even refuse to talk to you. So just try to get their trust. And so don't put them in the group therapy. They're not going to talk to anybody. They will stay in their room. You're going to cause more problems. So try to get the report. When they start talking to you, telling you stuff, that means you qualify to extend them to a group therapy. So this immediate group therapy is not needed. They will have hallucination. Hallucination is a sensory problem. You have touch problem, okay? So you have touch, okay, skin, you have that sensation, you have a smell, okay, you have hearing, and then all the senses that involve. The one that you worry about is hearing. Auditory hallucination, you got to find the content of it. So investigate the content of that. So the only thing that we should not expect is immediate group therapy, but the rest of them are what you expect in a schizophrenic patient when you're taking care of them. good content in a very short time. I intentionally said this question like that so that I can give you everything you need. If they give you in the case form, they're not going to deceive you. All this, you take what I've said in 1 minute or two. And if it's the case, just go through the case, find the keywords, and then analyze it. And they say, oh, this is a positive symptoms. This is consistent with the diagnosis. When they're going to ask you, they ask you which one is indicated, like I've said, and that's the way they will set it. Okay, good luck. Number 8, which room assignment is appropriate? Oh, we got to put somebody in the room. And there's only a few things you have to know about room assignment, straightforward. And nurse is receiving reports with the HIV patient, CD4 count of 500. So it's immuno what? Even though he has HIV, it's normal, it's not completely immunocompromised. It's above 200. Need admission. So who do you want? You don't want to put in some place that somebody will going to affect him. No, so no infection. That's the key. He's immunocompromised because he has HIV, but CD4 can't make him normal. So put him in a place that nobody have infection, okay? So I want to say this guy is in contact precaution, no negative. Scabies, this guy is in contact precaution, he can't share anything. These people can share something with MRSA and scabies, that's all. Client post-op appendectomy. He has appendectomy, right? Right? He's appendectomy. This guy is not going to infect him. What are the precautions you use for this? Standard precaution. So if you put these two together, it's not going to affect him. It's not going to give his blood for him to drink it. No. Just because they are in the same room, and he has HIV doesn't mean he's going to transmit the HIV. Yeah. Because the only option you have brachytherapy is getting radiation. There's no way we can put the HIV patient in a radiated room with somebody who's getting, nobody wants to stay with that patient. So the only patient you can be with is post-op. Because it's not infectious, it's not going to make appendectomy patient infectious. Selected apply. Which of the following the nurse should evaluate on assessment? The same thing. A nurse is caring for a client with what? Suspected diagnosis of what? Depression. So underline the keyword depression. That's all. And what did I say? To evaluate. What do you see on evaluation and assessment of somebody with depression? Write this down. SIGCAP. When they give you a depression question, this is what? Sleep problem. Their interest go down. They feel guilty. Energy go down. What? Concentration is affected. Their appetite goes up and down. They have psychomotor agitation. That means irritable and suicidal ideation. So they have sleeping problem, psychomotor agitation, weight gain, feeling of elevated mood. Their mood doesn't go up. Okay, this is a mood go down. And a feeling of what? Hopelessness. 1, 2, 3, and 5 are your right answer. SIGCAP is the question for your key. Number, I make a mistake. Number 10, I think it's 10. What is the problem? Selected apply. Which of the following the nurse should expect? Selected apply. A nurse is caring for a client due to recurrent lung infection. Okay, recurrent lung infection and a large voluminous stool requiring multiple admission. This is a case form by shortening it. I don't want to make a long case, but look at it. Which of the following, that was my plan to make a case, but I feel like I can give you everything in the very short form. Which of the following the nurse should expect? So then you go and rewrite your stuff. Select or apply. And then caring for a client with lung infection, buzzword number 1. And large voluminous stool, a lot of stool requiring admission. So which diagnoses have lung problem and a stool problem? If you can figure out test taking skills, look at the answers, look down. If you see, oh, this look like something I know, yeah, that's what sometimes they will give you vague questions like that, but it's not vague. They want you to critically think. They've given you enough information to connect the dot. Which clinical condition as a recurrent lung infection, and they also have large voluminous stool, some fat absorption issue in the lung. So you have a lung problem and a pancreas problem. Guess what? Cystic fibrosis. Okay, cystic fibrosis. Then you come down for the underlying problem, right? They have salt imbalance problem, making their fluid all thick so that they cannot clear their secretion. The pancreas cannot secrete anything. Everything is thick. If the pancreas cannot secrete anything, fat absorption is what the pancreas is involved, like lipase, amylase. So therefore, the stool is like voluminous and all fatty. What happened? If they're losing all their fat, they cannot absorb fat soluble vitamin. So that's why replace their fat soluble vitamin, right? If they're losing all their fat and they're having large voluminous, they cannot grow. They have growth retardation, right? Therefore, if they're eating, they need enzyme to eat with. Because they cannot create their secretion, the secretion is too thick, they get recurrent lung infection. How do you break that? You bang the back of their chest or their back, okay? And that is chest physiotherapy. You know the underlying problem. It's a salt problem. So give them salt, okay? So salt tabs is very good so that they don't get dehydrated. Because they're losing a lot of fluid, what do you give them? A lot of calorie, protein, and fat so that they can grow. So low calorie is wrong. So this is wrong. They need high calorie, high protein, high fat diet, right? They cannot, their secretion is all thick. So the semen is also thick. They cannot come out from the vas deferens. What I mean is, if this is your penile area and the urethra go here like that, the vas deferens go into the testicle, it come from the testicle, right? And then this is what drain the testicles with semen. This is thick. It can't go through. So, and therefore these people, they cannot have babies. They're sterile. So these are all the contents you have to know for this particular. They can go outside and play, but they should not go when it's too hot. So that's why you give them salt tabs and other things. So, but they can go. Exercise is good for them, improve their lung function. That's all. That's the content you need. The same thing, content for this problem, selected and apply. Which of the following is consistent with the diagnosis? A nurse is caring for a client with rheumatoid arthritis. This small question has everything you need to know about this, the problem. I have rheumatoid arthritis. What is consistent with the diagnosis? What is the problem? They have is an autoimmune problem, and they have inflammation of small joints. And this joint gets stiff. That's all. So we got to take care of the autoimmune disease and prevent stiffness. That's the whole pathophysiology of this problem. Therefore, morning stiffness is very good. If you're not moving, it gets stiff. It's due to wear and tear. I just told you, it's an autoimmune. It's not osteoarthritis. This is osteoarthritis. It's due to wear and tear. This is not due to wear and tear. Symmetrical joint involvement, because it's an autoimmune, it can affect both joints. Large joint involvement, no. The tiny joint in your fingers, yeah, toes and other stuff. Large joint is for osteoarthritis, your knees and other stuff. Range of motion exercise in the morning, yeah, because it's stiff. So we got to put range of motion exercise again. In order to prevent stiffness, you have to lay on a hard mattress in the neutral position, so hard mattress. Of course, we need to take care of the underlying problem, autoimmune disease. You use immunomodulators. That's what we use. Classic autoimmune question. This is the way they're going to ask you, even if it's in a case form, just sit back. Let them give you so many information, but they will ask you every one of this. They will ask you management, medication, teaching, everything is in that 7 answer choice. There's teaching there, everything, what you need to do and everything. Short and precise and concise. Okay, guys. SATA. Which of the following need immediate intervention by the charge nurse? What do you think? A nurse is caring for a client with rheumatoid arthritis on methotrexate who need vaccination. So I take you to a different form, but I'm going to tell you what we did in question 12, right? You see, this is immunomodulator. That's what the treatment, because it's an autoimmune disease, right? Which of the following I need to intervene? The kid whoever it is, need vaccination, and you have rheumatoid arthritis. These are buzzwords I've taken, put it together now. I have a rheumatoid patient, so they ask case buzzwords and rewrite. That's what I'm doing. Rheumatoid patient on methotrexate needs vaccination. So it's immunocompromised because it's on methotrexate. If you need vaccination, what kind of vaccine you can give them? You cannot give them live vaccine. You break down the question. 50% of understanding the question is already answered. You already answered the question. Therefore, oral polio is a live vaccine. We can use it. MMR is a live vaccine. We cannot give it to them. Influenza, the nasal one, is a live vaccine. We can give it to them. DTaP is not a live vaccine. Varicella is a live vaccine, and yellow fever is a live vaccine. So the only person you can get is this. So let it apply. Now you have to be careful. If you know it, pick it. 99, 100% sure, yeah, you pick it. There's only one answer chair. If you pick more than one, you get 0 for that question. So pick those you confidence, okay? You have confidence on. 14. A nurse is caring for a client ready to go home after Roux-en-Y gastric bypass. Which teaching is appropriate? Guess what? Which teaching is appropriate? What is the buzzword? I have Roux-en-Y gastric bypass. Roux-en-Y gastric bypass. What do you think? All it means is every time they give you a question and they say something about connection to your stomach, just know that you're losing your stomach. I don't have to give you detail. And the people everything is being rerouted in a different way to form like a Y form. If they give you gastrectomy, it's the same thing. Bureau of 1, Bureau of 2, don't worry about it. They will use different ways to confuse you. It's the same thing. Roux-en-Y, B1 gastrectomy, B2 gastrectomy. The key fact is things has been rerouted. Therefore, the key thing you should worry about these people is dumping syndrome. That's all. What does that mean? They eat and food rashes like that. Severe glycemic index, and then drop to hypoglycemic, and they start having hypoglycemic symptoms. Therefore, because of that, we want them to eat small meal at a time. So 6 times a day is good. Not eat 3 meals. 6 times, small meal will be very good for this patient. You should separate your liquid from your solid. Don't mix the liquid with the solid. So mix liquid with solid. This is wrong. High simple carbohydrate diet. This is what you should avoid. This is one of the problems that causes the symptoms of hypoglycemia. Don't take anything that has simple carbohydrate. What food, therefore, you take? Well, high protein. That's why these people, when they do a bypass, they do protein shake for them, fat, and then complex. Complex carbohydrate is good, but not simple. Okay, complex carbohydrate, it's okay. So high protein, high calorie, high fat. Okay. Lay down for at least 30 minutes after meal. Yeah, after you eat, you just lay flat so that food doesn't just drop into the small intestines right away and cause symptoms. So this is good. So 1 and 4 are the right answer. You pick those with confidence. If you don't understand the question, just leave it behind. Select or apply. A nurse is caring for a client in cardiogenic shock. Which of the following medication will improve cardiac function? Pay attention. I'm in shock. We're improving cardiac function. You need ionotropes. Which of this is an ionotrope? It's no brainer, right? This is pharmacology, straightforward. I give you the problem. I told you what is needed. All you need to do, farm tips, rewrite them, cardiogenic shock. I need to improve cardiac function. Therefore, I need an ionotropes. Then you look at it. Which one is ionotropes? Dopamine, ibutramine. You know this. This is a FeOS. This is a nitrate. It will drop your blood pressure. Atropine. It's a non-ionotropes, right? It increases your heart rate. Albuterol is anti-arrhythmia. This patient does not have arrhythmia. We're going to cure them. So, this and that. More assisting, select reply. And nurse is caring for a client on what? This is the farm. We've reached the farm portion of it. So pay attention. Fluoxetine due to new diagnosis of depression. Which of the following teaching require immediate intervention by the charge nurse? So I'm going to underline a few things. Fluoxetine, immediate intervention. Don't underline too much. So I have depression. I've been giving fluoxetine. Now I need the nurse need to intervene. What do you think? This is what? What kind of medication is it? Pharmacology, if you don't recognize the medication, sometimes it becomes difficult. You can look at the answer choices and see if you can recognize it. But if you don't, it becomes a problem. But you can look, they've given you depression. So you know it's antidepressant. What is the most common antidepressant we have? It's always SSRI. Okay, but don't use that because they may change it. But I know that this is an SSRI, right? Right? So I know that it's a depression. So I should have a depressive medication, but you have to recognize which group it is because they're not going to tell you. If you're taking SSRI, serotonin receptor reuptake inhibitor, that means I'm increasing serotonin. So that's how they do their job. Therefore, what do you tell the patient? Medication will take work, 1 week to work. No. It can take 2 to 4 weeks, sometimes, and 6 weeks for the effect to be seen. So this is wrong. So this is why we have to intervene. Expect weight gain. This is good side effect. That's one of the side effects of this medication. Expect decreased libido. Yeah, they don't like it. Sexual dysfunction, common side effect. We will need frequent appointment the first few weeks. Think about it. Why do I need frequent appointment the first 2 weeks? As soon as you start patient on SSRI, you worry, especially 2 weeks after you started, their suicidal ideation goes up and they may kill themselves. Therefore, you need to see them more frequent. So this does not need intervention. You need more appointments so that I can make sure you are not suicidal. Avoid St. John's wort. What is St. John's wort does? It has a lot of serotonin. If you combine that, you have serotonin syndrome. So we don't need intervention for this one. Go to the emergency room with sudden onset of fever, irritability, and excessive swelling. Look at it. All of a sudden, my temperature is up. I'm hot. Everything is up. That's all. I'm hot. Everything is up. And I'm taking what? SSRI. I'm using buzzwords so that when you hear it, you're taking the test, you can hear me talking about it. You hear my voice, right? I'm taking SSRI. All of a sudden, I'm hot. Everything is up. Irritability, sweaty. What do you think? That's serotonin syndrome. What do? Stop the medication, hydrate them, and cool them down. Isolate, right? And give them dantrolene to help with the muscle spasm and rigidity. So this is a good teaching, good teaching, good teaching, good teaching, good teaching. This is the only one we need to intervene. Everything on SSRI, but you have to recognize the medication. 70. Select or apply. The same thing. And this is caring for a client on phenixin. We saw something saying before. What do you think? It's not the same. You have to remember this medication. Phenixin, due to new diagnosis of depression. Remember, I've given you that this is for depression. The other one was for what? Antipsychotic. Which of the following? So pharmacology, they have to give you some idea what is the medication for, or you have to recognize it. Which of the following teaching require immediate intervention by the charge nurse? Select or apply. So break it down. I need to intervene. I have depression, and I'm taking this. You see it? Is it SSRI? I don't know. You ask yourself. But you have to recognize some of these medications, these diagnoses, especially depression. If before you go and take a test, look at all the SSRI that is under. Look at the TC8 and look at the MOIs. This is one of the MOIs, right? This is one of the common ones they use, phenixin or selegimin. And this is one of them. So they like selegimin and then phenixin, but sometimes they will give you another one, wrong, weird name you've never seen before, but they are the same. You got to Google them and just picture them in your head. So this patient has depression, prescribe MAOIs, okay. Monoamine oxidase inhibitors, right? What do you think? These medication, you have to avoid tyramine food, right? So add smoked meat to your diet is wrong. Smoked meat is dangerous. It has tyramine in it. So we got to intervene. Avoid St. John's wort. Yeah. You cannot combine this with SSRI. And what is SSRI? It's a serotonin. It increases your serotonin. What does St. John's wort does? It increase your serotonin. If you combine it, you have serotonin syndrome. So we do not need to intervene. Avoid salamine. Salamine is a tyramine. It contains tyramine. So that's a good teaching. We should tell the patient to avoid it. So they should not do that. And they should avoid it as indicated. But that's good teaching for now. So that one is good. Use nasal saline drops for cold. It means if they have cold, they should not go to Walmart and go and buy cold syrup or nasal decongestants. Why? This medication, okay, it leads to production of norepinephrine, epinephrine, serotonin, norepinephrine, dopamine. All this increase your blood pressure. If you combine ephedrine, which is contained in cold medication, it will increase your blood pressure. You develop hypertensive urgency. So they should not take any cold medication. All they can take uses saline drops to decongest the nose. So this is very good teaching. We will wait at least 2 weeks to switch you over to a new medication if no improvement. Yes, if you have to change them to a medication, especially SSRI, which usually happen, you need a washout period. Washout period for 14 days. Otherwise, they will develop serotonin syndrome. So this is a good teaching. You can stop the medication immediately if you gain weight. Guess what? One of the common side effects is what? Weight gain. But this medication take a while to work. You can't just stop it right away. It become a problem. So this is wrong. Immediately, no, you never stop one medication. Let me know what is going on and I can tell you. You yourself cannot stop it. So this needs something. Avoid aged cheese. Yeah, it's tyramine in it. So this is a good teaching. So the only thing we need to intervene is 1 and 6. If you don't know it, just leave it behind. Okay, just leave only 2 answer choices there. But you got to pick one or at least one. Okay, otherwise the computer will not let you go for it. Next question. Select or apply. Which of the following the nurse should include in the plan of care, right? A 23-year-old present to the emergency room with abdominal pain that started in the periumbilical area. Look at it. And now located on the right side of the abdomen. His pain is 8 out of 10. They suspected appendicitis. What do you think? So he came in, the pain started from here. Now he's on the right lower quadrant. Suspected appendicitis. It's an itis. What do I expect? An inflammation. So MPO. In the GI, if there's any problem with the GI, appendicitis, cholecystitis, anything that involves the GI, there's certain things you can do. That is like, you don't even have to think. Patient themselves will not eat, so they make themselves MPO. If you're not eating, I need to give you IV fluid. If you have itis, it causes pain. I need to give you pain medication, right? Itis infection, you need an antibiotic, right? Those are 4 things. Sometimes if they vomit, they need NG2. But these are things you can do that easily. If they're bleeding, you give them blood. So this patient is not vomiting, no NG2. IV fluid, we said about it. Antibiotic, yeah. Appendicitis does not need bowel prep. They will trap you. This is wrong. You prepare them for surgery. You should not shave them, even though you think you're doing something, it causes infection. The surgeon will shave them in the operating room using razors, okay? No, using clippers. They use clippers to shave them, not razors. That will make a cut and that will cause infection. But you're not supposed to do that. NPO, IV fluid, antibiotic, and prepare the client for surgery. That's all. All right. Which of these medication the nurse should question in the client with severe what? Decompensated heart failure. I have severe decompensated heart failure. Which one should I question? You have to bring your pharmacology. Propranolol is very used for severe decompensated heart failure, so we should not question. The digoxin, we give them some ionotrope. This is a nitrate that also will help with that. The Albuterol will drop the heart rate too much, so beta blocker is not, it's the contraindicated, but you can use it in heart failure, not in the decompensated form. So that's the answer. And then last question, maybe. Which of the following need immediate intervention? A nurse is caring for a client with what? New ileostomy. I have new ileostomy. What do you think? A new ileostomy should not eat high fiber diet, usually low fiber diet, right? So that one need intervention. Client does not look at the stomach. Yeah, it will take some time to adjust. Stoma is productive with green liquid stool. That's what is supposed to come out from it. Wound care consult place immediately so that it can start involving the patient in teaching. So that's not bad. So the first one is high fiber diet. And that is the end of it. Thank you for your time. 20 NCLEX review concept with pharmacology. I guess it's 19. But take care of yourself. If you've not subscribed, you know what to do. Look down, click, put your notification on, and you hear from our Dr. NCLEX. I promise you. And if you need help with content, just go to Adapt NCLEX and join us on Saturdays as we review content. All the best of luck and keep charging. That's the key. Keep charging no matter what. Never stop charging. Bye-bye.